With injectable preparations, return of fertility is delayed. There's a whole truck of red flags, or a whole ship carrying red flags from China, just coming from far. We can see it from the horizon, right? So, with the injectable preparations, return of fertility is delayed. The cycles take several months to normalize, or may not do so at all. Practical considerations. Please sit back and enjoy this one, because this one is going to get interesting, and this one will open up your head. It is in the syllabus, but your doctor, I don't know if we skip these pages, or I don't know, we just cram for the sake of the exams, and then we come out there to regurgitate the syllabus to you. So listen to this. Practical considerations in concern to the hormonal contraceptives. Number one, discontinuation of all oral contraceptives results in full return of fertility within 1 to 2 months. So if you stop it, you only take 1 to 2 months and your fertility is back. Hey, amazing. There may even be a rebound increase in fertility. Hey, the marketer was good. There may even be, the word is may, so they are very keen with their wording. There may even be a rebound increase in fertility chances. And then chances of a multiple pregnancy are more if conception occurs 2 to 3 cycles. You're wondering why those women in Kakamega are giving birth to 5 children who are so feeble. So feeble. Now look at them telling you the truth. So they tell you that fertility will come back 1 to 2 months. And this fertility can actually be rebound increase in fertility, right? And then the same people are telling you chances of getting multiple pregnancy are more if conception occurs 2 to 3 cycles. Aye. Well, anyway. With injectable preparations, return of fertility is delayed. There's a whole truck of red flags, or a whole ship carrying red flags from China, just coming from far. We can see it from the horizon, right? So, with the injectable preparations, return of fertility is delayed. The cycles take several months to normalize, or may not do so at all. I rest my case. Let's continue. They are to be used only if the risk of permanent infertility is acceptable. Ladies in the building, listen keenly. The injectables, they are to be used only if the risk of permanent infertility is acceptable. That is just number one. Hey, my guy now. Where is my guy now? Why are you not telling women this truth? My guy now. Anyway, let's do number 2. So that was practical consideration number 1. Number 2, if a woman on combined pills misses to take a tablet, she should be advised to take 2 tablets the next day and continue as usual. So if you miss today, tomorrow take 2 and then continue as the normal way, the way you keep using them. And then if more than 2 tablets are missed, and then the cause should be interrupted. Sorry. If more than 2 tablets are missed, and then the cause should be interrupted, an alternative method of contraception should be used, and the next course started the 5th day of bleeding. Ladies, do you know this? That today you miss a pill, tomorrow you have to take 2 pills, and then continue as normal. But if you miss 2 pills, stop taking the pills. Because if you continue taking the pills, you get pregnant. And if you get pregnant, that pregnancy has to be taken out. That child will be super retarded. Super retarded. We are wondering where all these issues with mental health are coming from. Now you have the answers. Now, so that was number 2. What else? Good. Let's go to number 3. Practical consideration number 3. If pregnancy occurs during use of hormonal contraceptives, mlinipea kazi ya kuwasomea, so nasoma nyinyi muelewe, okay? Number 3, if pregnancy occurs during use of hormonal contraceptives, so you're using contraceptives, the ones that have hormones, and then you end up getting pregnant, what should you do? That is, it should be terminated by suction aspiration, because the risk of malformations in the baby, and then genital carcinoma, carcinoma means cancer, in female offsprings, imagine cancer in your offspring, and undescended testes, we call it cryptorchidism, in male offspring is increased. Hey, hey. Am I the only one who is getting scared? Are people getting scared? I'm actually scared for our women. So if you get pregnant when you're using these contraceptives, one, you have to terminate that pregnancy. Because if you don't, one, the offspring that is coming out, mentally retarded, I told you that. Number 2, in the males, they will have undescended testicles. Now I know there's a woman here whose son is having that problem. Their abdomen is swelling all the time because their testicles have not descended. Because remember, when a child is born, their scrotum is empty. The testicles are still in the abdomen, in the upper part of the abdomen. And then now they descend into the scrotum. But these children do not have descended testicles. Why? Because testosterone levels are down. Estrogen levels is super high. Now in the ladies or in the baby girls, you've done a gender reveal, you've poured pink. We know this one, boom, baby girl. And the baby girl comes out with genital carcinoma, cancer of the cervix, of the vagina, of the endometrium, and all that. And then now, boom, you put out our subgroup. We have to get money for you, for this baby now, for the surgeries and for the chemos. But we gave you money for gender reveal, right? Anyway, let's continue. Number 4. While for most women, a pill containing 30 micrograms of ethinyl estradiol is sufficient. Now, this one is a good one. While for most ladies or women, a pill containing 30 micrograms of the synthetic estrogen, ethinyl estradiol, is sufficient, the obese may require a pill containing 50 micrograms. So hey, this one is imechoma. If you're obese and you take one pill, you're taking an underdose. Hey. Hey. Sijui kunywa maji. So ladies, this is the reason why I tell you lose weight. So if you're obese, you need 2 tablets or so. Because one is not enough. That's an underdose. Okay? So you need 2 tablets. Anyway, let's continue. A pill containing 50 micrograms and only 20 micrograms may be appropriate or sufficient for those with cardiovascular risk factors, as well as for those above 40 years of age. Now, women who are above 40 years of age don't even bother using any contraceptive. Like these ones, the hormonal, don't use a condom. Because the risk of heart disease is actually up because you're eating unhealthy foods, of course, because of the lifestyle. And then you use these drugs which have estrogens. And these estrogens are actually causing thromboembolism. And they cause you heart disease or heart attack and the strokes because of the risk of blood clots. And we'll talk about those. I'll just read out through the side effects of this, okay? So you're using this drug. If you're 40 years, you're actually supposed, and then in good weight, you're supposed to use about 20 micrograms. For a normal lady in good weight, in the early ages, 30 micrograms. For an obese lady, the overweight, the fat, you're supposed to use 50 micrograms. Hey, the last one, number 5. If breakthrough bleeding occurs, so you're bleeding between the cycles, right? The breakthrough bleeding occurs, switch over to a pill containing higher estrogen dose. Higher. If you ever bleed through the cycles, switch to a pill containing higher estrogen dose. Now you're bleeding because of estrogen, and don't worry, don't even drop the contraceptives. Simply change the drug. Does it ring a bell? Hypertensive people, diabetic people, do not worry about your rising blood sugars. Don't worry about these drugs. We'll do away with this drug, we'll give you another drug that acts the same way. We will add you another drug, so don't worry. So if you're having the vaginal bleeding, don't worry about the contraceptive. It's not the mistake of the contraceptive. No. It is your mistake. So what do? We'll just give you another contraceptive that has higher levels of estrogen, which actually caused you the problem. So don't worry. I mean, it's just estrogen, right? Number 6 and the last one. In women with contraindications for estrogen, a progestin-only contraceptive may be used. And what are the contraindications of estrogen? Heart disease, the risk of stroke, the risk of bleeding, those who have DVT, those who have weak bones, those who have hypertension already, those who are obese already. So if you are there, so if you're in that category, you now change the drug. Don't even worry again about the contraceptive. Simply change the drug to the other pill, which is progestin only. Now, I rest my case. And as I finish this, let me tell you about the side effects of hormonal contraceptives. Number 1, nausea, vomiting, and all those migraines and headaches. That is one on the list. Number 2, breast tenderness, very painful breasts. Of course, when you're trying to get to a menstrual cycle. And sometimes all through, you just have breast tenderness. Number 3, mood changes, the mood swings, the anger, the anxiety. Sometimes you're thinking it's the lack of identity, and in real sense, it's just these contraceptives that you're using. Depression is there. And of course, we have a drug for you for depression. Antidepressants are there. Number 5, breakthrough bleeding, the one that you just mentioned. So if you have breakthrough, go to high dose of estrogen. Wah! So spotting and bleeding between cycles. And then number 6, high risk of blood clots. Therefore, a risk of stroke, a risk of pulmonary embolism, and a risk of heart attack. They never tell you these things, do they? Okay, number 7, hypertension and atherosclerosis, thickening and narrowing of the blood vessels. Problems. Number 8, of course, obesity. Obesity is part of it. Number 9, liver disorders like the liver cancer, jaundice, and gallstones. Number 9, bone density loss, especially for Depo-Provera. Bone density loss, osteoporosis. So weak bones and you're prone to these fractures. Number 10, low libido and vaginal dryness. So you have low libido, and that 1% that you have libido, your vagina is super dry and the sex is so painful. Number 10, of course, the risk of PCOS, endometriosis, fibroids, infertility, multiple pregnancies, okay? All these issues. And the cancers, of course, are there. And then we have diabetes. We have, of course, hair loss and retracting hairline. We have acne, severe acne. We call it cystic acne. And then we have autoimmune conditions like SLE, the lupus. And then we have delayed stroke, total loss of fertility. And they lied to you that this one is temporary suppression. Hey. So those are the side effects of those hormonal contraceptives. So now, let's have an agreement. Are you still going to use these contraceptive methods? Are these the things that you have to log into your system, ladies? Do you really want to log these things into your systems? So now that we've had this conversation, you will see, if I do just a portion of this video and post it on TikTok, you will see how many ladies will come and bring their emotions there. They are forgetting those emotions. I understand them. Those emotions are basically because they have the contraceptive. They have the implant. So I know, I understand them. Sometimes you even get scared for me because they put on all these negative comments. Anytime I talk about masturbation, men are coming after me. Anytime I talk about hormonal contraceptives, women are coming after me. I'm looking at them and thinking, this is not your problem. This is a problem that was brought to you by somebody. You just don't know it. You just don't know it. Birth control is in the hands of the men. If your man cannot retain the semen, if he cannot perfect the pull-out game, please, you have this conversation with your man and ask your man if he can go and chop off, do a vasectomy for you. Or tell him to go and take Gosipol, the hormonal contraceptive for men. Go and tell him to take that anti-cancer drug that is supposed to destroy his manhood. Just look at his face. The way he will look at you, will never repeat that mistake. So if him as a man knows or understands the dangers that are coming with these contraceptives, why would he put you on that contraceptive? Now, ladies, you can use it for fun. Use it because you want him to enjoy his sex. But remember, we can give him the money to take you to hospital so he can afford your bills. But the effects or the dangers are going to happen to you directly. So you're the one who is going to suffer. Now, weak men will think I'm actually poisoning their women against them. But the reality has to be said. The reality has to be said. No man wants to see a woman who has cervical cancer. No man wants to domesticate a woman who has fibroids and all these medical bills are coming on to him. But he's the one who will push you to do these contraceptive methods. You will give birth to 5 children, we will celebrate you, but we will be looking at these children and wondering, oh, umerogwa. Because it's the same man who will tell you, wewe lazima umerogwa. How can you come? How can you give me 5 children and all of them are retarded? You sacrificed your womb. You actually gave your womb to Illuminati. And he will leave you for another woman. The only problem is he is the constant one in this relationship. So he'll still give that other woman contraceptives and still experience the same problems. So it's time for us to grow up, okay? So man, it's time for us to stop blaming the spirits, blaming the curses, blaming on God, blaming on genes, and we need to fix what we have to fix. Most of these things that are brought to us, we need to question them before we use them. Some of them are not used in their countries. Okay? Some of the things that are donated to us in form of the AIDS, they are not eligible to be used in their countries. And the rules for donations is that anything that has to be donated to a country, it has to be eligible for use in their country, the country that is donating. But they give you fertilizers, right? They give you the GMO seeds that they don't use in their countries. They give you hormonal contraceptives that they don't use in their countries. And they use your governments to actually destroy you. So the government is not here to protect you. Protect yourselves, protect your women, and protect your children. We need that generation.